Hey, hey, hey. I am back. I know it's been a minute, but I'm back like I never left in the first place. So, welcome to Keeping It 100. Thanks for tuning in. You know, this is where we have these open and honest conversations to make sure you get all the information you need to make better health decisions. I am your host, Dr. Kristin Motley. I'm really happy to be back. And of course, as always, we have a really good show for you today. As always, when you think of questions, pop them in the chat. Let us know what you're thinking, how you feeling. My friend and colleague, Dr. Tanya Thomas, is behind the scenes. She's going to make sure all your questions are answered. So thanks, Dr. Thomas. So let me bring in my awesome co-host, Mr. Dr. Georgie Mink Jr. How you living, G? We back. You on mute.
Oh, I'm so excited you back. That's what's up.
You funny.
No, I feel like you've been going all summer, Doc. Wow. I've been doing shows by myself. Like, it's been ugly. Me and Tanya, like, we held it down, though. But welcome back.
Y'all been holding it down. It do feel like all summer. I think I missed 3 shows. Once I told you I started Noah in daycare, which was already a whole thing. Right. And the boy ended up getting sick because that's what happens when kids go to daycare when they've been secluded from the world for their whole life, like Noah has. He ain't been around his cousins. He ain't been around nobody. I ain't letting nobody around him because ain't nobody getting him sick with COVID. Now he ended up going to daycare. He get everything. He had an ear infection. He had pink eye. He had RSV. It was a whole Lord. So he got me sick, and then Bilal got sick. It was a whole thing. So,
but he didn't have COVID though. So,
but he never got COVID. Right. I sent him with that mask on. We tested like every day.
Right. He did not get COVID.
He got everything
else. Right.
Oh Lord, please protect him. So he went back. Thank you. So he's back in daycare. It's the first time in 3 weeks. So we'll see how he makes out after this week. But how you living? What you been doing? What you been up to?
I'm still in the streets. I'm still practicing and stuff. You know what I mean? I actually is really starting to be like heartfelt though, because I'm starting to get like phone calls from people, and you know, like this boy mom called. I don't even know where she got my number from. So I'm like,
that business card you be handing out.
It probably was. But you know, she was just like, what's up? You know, I want to thank you. You talked my son and to getting his vaccination shot. Now he can go get a job. It was like one of them jobs that was like making it like mandatory or whatever. And then she said it's crazy because right after that she had got COVID.
Oh wow.
And she was vaccinated, but he wasn't.
Okay.
At the time that she got it, though, he was already vaccinated. So she said he didn't get sick, and you know, just saying what could have happened, and it was just like, wow. So we changing lives, Doc. We helping folks.
We're trying. Yeah, we are trying. You in the streets, you're doing it. That's awesome, and I know it feels good to get those calls because you never really, as a healthcare provider, you don't always get the follow-up calls, especially when you do community work. So, like, I'm not always seeing the same people. You know, each week or each month or each year, you see whoever you see out in the streets. So it's good that you were able to get a follow-up call to hear a success story, because that is what it's about: connecting with people, helping them understand, giving them information on whatever health topic it is, but letting them come to make their own decision. And I'm just grateful to be a part of this. I'm grateful to have you on the team. You're doing an amazing job, and it's just great for us to work together. So go ahead, Georgie.
Yeah, we winning chips, Doc. That's what we doing.
Yes, absolutely. All right. So before we get into today's show, I just want to give a quick shout out to John LeBron at LeBron Construction. So I saw his ad on CMP radio page, and I said, you know, like I need some work done outside. So I called him, and he said, I'll be down there by 6:30. So we came, and he told me he was here, and he was like, I just need to ask you, have you or anyone in your household had COVID or been exposed to anyone with COVID in the last 2 weeks? I was like, yo, this dude just screamed me for COVID.
He on our side. He had to make sure he was like, he had to make sure he was down.
You can do any work in my house at any time, John LeBron. So I just thought that was funny because I wasn't expecting that, but he was like, like, I'm just trying to protect you. I'm trying to protect me. I'm like, say less.
We need to be on the team. Shout out to
John
LeBron. What's up, man? Listen, black businesses, we doing it. That's what's up.
Yes, absolutely. So I'll let y'all know if he get the job and how the work turned out later. But the boy came with a COVID screening questionnaire, and that just blew my mind.
Yeah, he got through customs with that because that's your talk. Y'all be walking around here with spacesuits on. Y'all be playing, so yeah.
You go ahead and pass go, John LeBron. So just wanted to say that was funny. I was cracking up. Yeah. So before we even get started with today's show, I just wanted to say real quick. Last time we were on a while ago, we talked about a Chester versus Darby battle for Juneteenth because we did COVID vaccine clinics. We did one in Chester in the morning. Then we was out in Darby for another COVID vaccine clinic. So I just have the scores, and I just want to let y'all know who won that chip. So Chester had 7. Darby had 11. So Darby won. Right. So congratulations, Darby. Y'all ain't gonna win nothing else. That's it. So just be proud of that. I'm proud of y'all for coming out and getting vaccinated. But Chester, we gotta step up. We gotta do better. We can't be letting other towns, show up, especially when they got less people. Like, how they outdo us?
Yeah, that's a little rival, but it's all right. It's all right. We can catch up. We got one coming up soon, like later on. So, I'm going to catch up. We're going to catch up. It's getting ready to be the winter. We got 3 months before that. So I got faith. I got faith in the black and orange. So we'll see.
Thanks, Georgie. Thank you. But you've been doing a lot of work out in Darby and Sharon Hill in that area. So I'm not surprised to see that we had
I think that's what it is, though. Like, I've been going to a good spot, the rec center.
Yep.
With Councilwoman Janice, Rudy Taylor, and Lucille Pratt, and they active out there. So they've been my links to moving around between Darby and Yaden, and a lot of people. The police officers on point, like they really building down there. Darby doing some good things. So I'm just happy to be a part of that transition with people, getting more aware of their health. And meeting some good folks, though. It's your fault, though, but I appreciate it. Thanks.
Keeping you in them streets. That's where we gotta be. That's where the people are. So that's where we're gonna do our work. Always. So good job, Georgie.
Yeah.
All right, so let's get into these COVID updates. There's a lot going on with COVID. Number one, COVID is outside. In case y'all was wondering, COVID is outside. So y'all can't be dependent on the news to tell you what's going on. To be, you're not going to hear people talking about it, but COVID is not playing. It hasn't stopped playing since it showed up, and so it's doing the most. It's going to keep doing the most as long as we do the least. So we there's a lot of reports going around talking about the new variant. Well, the new version of the Omarion. So Omarion he keep having kids.
Yeah, he got gang members.
He got a whole tribe. So. The newest problem child is BA5. So that's the subvariant of the Omarion variant. And it's really, really transmissible. It spreads super fast. It spreads more efficiently than the original coronavirus. It spreads better than Delta. It spreads better than the original Omicron virus. It's just doing the most. The good thing about it, though, is that you don't get as sick. So it's causing milder symptoms, but because it's spreading to more people, more numbers of people are getting sick because it spreads so easily. So that's why y'all got to stay masked up. You just got to keep protecting yourself, putting yourself in smart situations where you're not at risk of getting COVID. And this is for people who have been vaccinated, especially people who have not. Now, one thing that has not changed since these vaccines have come out is that people who die or end up in the hospital with severe symptoms from COVID are people that are not vaccinated. That hasn't changed.
Wow.
That's the same. And so if you're not vaccinated, we want you to engage with us. We want you to ask questions. We want you to get your questions and concerns addressed. because you're putting yourself at risk that could be avoided, that could be prevented. And I know people are out there saying, I had COVID, I beat it, it's good. Omicron, Omarion, don't care. People are on their 5th time of getting COVID. And every time you let that virus in your body, it could do something else. It could cause these long-term effects that are preventable with vaccination. And so I was reading about 100,000 people are testing positive for COVID every day in America.
Wow.
And so, and that's not even accurate. That's what gets reported because people are doing home tests now. So the home tests don't get reported.
Right.
So that's probably on the low side of how many people are really positive. So COVID is relentless. George, what you thinking?
Hey, I mean, the numbers are still scary. I mean, and it's still multiplying, like you said. It's going into different chambers of the variant. It's still the same effects against somebody that's not vaccinated, though. So I'm just feeling like it's just really time, even if you're not on the booster list, at least you got to get on the vaccine list at all. Like, it's just like, come on. Like, we got past our theories. We got past, our past fears and all that stuff. Everything is proven. It's just time to just get on board. That's why I've been coming at people like that. I mean, I really haven't been like forcing them, but I've been giving them real information like, yo, this is what's really going on. You still can have your doubts, but I'm telling you, to match that doubt, this is what's going on. This is the truth. So some of the stuff might be fabricated as far as, like you said, the number's not all the way accurate, but 100,000 a day is a lot of people. Like, so if you're not vaccinated, that means you can still, your body still could get jacked up. You still can keep passing it to full. It's just certain things. Because there's no way you practicing all the extra stuff. Because I don't hardly see nobody washing their hands no more like they was. I don't see nobody using hand sanitizer. I might squeeze it every now, like every 2 stores or something. But I'm saying I'm not even conscious of the things that I was doing when it was like in the forefront.
Yeah.
But it's still in the front row. It's still in the front row.
It is. And I'm glad you brought up that point because a lot of those things, when the country says you don't have to wear a mask anymore or like public transportation and, when people say stuff like that, a lot of times it is political. It's not because it's the best decision. It's because it's the political decision. And so when we drop masks on the bus and on the trains and on planes, that wasn't because, it's so safe to not have a mask on. That was because a Republican judge in Florida said it was unconstitutional in his court. And so since he said that, he was a federal judge, the whole country had to go with it. So so you have to know that this is a very political thing, and decisions that are made are not always because it's the best thing. It's just because we live in a country where decisions are made based on politics and not what's the best thing to do. And we see that Roe versus Wade and all types of things. You see the progress we're making toward gun control is something, but it should have been done so long ago. And there's so much more that needs to be done. These decisions are political decisions, not because it's the best thing for us to do. So keep that in mind as you see changes with COVID. It's just so, I mean, they say you don't have to wear a mask, but I'm not going to wear without a mask on. So unless people around me are tested or, like I need some other assurance that you're not going to get me sick because I don't want to get my son sick or my husband or my daughter or anyone else around me, like my grandmother. So anywho, it's always
I don't wear a mask though. Like they said, we don't gotta wear them. I'm not wearing them, but I'm vaccinated and I'm boosted. But
listen,
I will wear them where I have to though. Listen,
I
will wear them where I have to. Like in certain medical facilities, you still have to wear them, which is fine. I have no problem. I actually want to wear my mask in medical facilities for some reason. I'm more conscious around medical facilities, but I mean, like you said, to each his own. I mean,
absolutely.
But if you're not wearing a mask and you're not really doing the things that you're supposed to be doing, the things that to prevent it, then I would advise that you get a vaccine at least so it could just be the sniffles.
Yeah, protect you and protect
I'd rather just have the sniffles with the vaccine than be laying up in the hospital with an IV. So
that's true. For me, it's a lot to do with Noah. So he hasn't been vaccinated yet. So I feel like I got to do whatever I can to protect him, because if I got to sit up in the hospital because this boy got COVID because I gave it to him, I'm gonna have a problem with that. So I'm just taking as much precautions as I can now. Once he gets vaccinated, I probably still wear my mask because I'm a little COVID crazy at this point, but I'm okay. It just doesn't bother me. So, people got to do what feel comfortable for them. Now, when you're not around other people who are vulnerable to severe disease, hospitalization, death, because y'all all are vaccinated, then it makes sense to not have on a mask, to some degree. But you just got to do whatever works best for you. That's all I say.
Right, Doc. I mean, it's just
go ahead.
Our people I just think people that didn't get vaccinated, their main thing is everything is back to normal. Everything else that was taken away is back to normal, but now we got something extra to deal with. So, it's really not back to normal. It's like it's back to the new norm. The new norm is we have to be protected against this virus or disease or whatever for life now. And we have to put it on our life list. So that's what I'm reaching out to brothers and, women as well. I'm just doing a lot of barbershop talk, but I've been talking to females as well. And I'm just like, how you not vaccinated, sis? And you got like 4 kids. What's going on?
Yeah.
You got to catch up because, you just never know. Y'all, if all y'all sick at one time, then what? So she said she would think about it. It was some female. She said she would think about it and all that. But that's all I want you to do. I'm not really trying to, because if it was up to me, I'd just grab you and go ahead, Doc, hurry up.
Get her.
But but I mean, it's just about giving our people what we doing, the information. Y'all hearing it from us. We got doctors all over the place. We got doctors running it in the back. We got doctors in front. Everybody connected in the same circuit, and it's our doctors of our own color. So if it's people that feel like that, so it's like, listen, it's real, y'all. It's real.
It is. I think that for me, the most important thing is letting people make their own decision. I don't like the idea of forcing people to do anything. We need to make sure people have the information so they can make a decision on their own. When people are making decisions, a lot of times they don't have all the information and they can't make a sound decision. If they had the information, then they can make a better, more informed decision. And if they feel like the vaccine is not the right thing for them because of what they know, then that's what their conclusion. But don't make a decision without knowing all the information, because that's what I did at first. I didn't know anything and I wasn't trying to hear it. I was like, nope, I ain't getting it. I don't want it. And it took me to looking at the information, really learning about it before I felt comfortable doing it. And I was like, okay, that makes sense. I need to get this vaccine. And I would do the same thing with Noah. His age group opened up for vaccines while I was away. So about 2 or 3 weeks ago, which is great. So the FDA and the CDC cleared the path to bring the youngest kids on. So 6 months and up can get vaccinated, which is fantastic. I've been waiting for this. I want Noah to get vaccinated. I can finally see the light at the end of the tunnel, so I can eat in a restaurant again, go to a comedy show, concert, have a good time. I'm looking forward to doing those things. But I'm not. But I'm not going to just hop in line first. So he's not vaccinated yet.
Oh, okay. You did all that, and you still sitting in the car. Oh, okay.
I want him to get vaccinated, but I still gotta look. I still gotta make sure
you're filling it out. You're in the filling out process. You leaning towards it, but that's why we're here though. We're not forcing any. Like you said, you want to do your homework. You're keeping an eye on it. That's the line you getting in, but you ain't getting in line yet.
Nope, not in line yet. No appointment set. I'm gonna just watch these kids get vaccinated, see if anything interesting come up out of it, and then I'll make a decision. Now, what I will say is that whatever comes up will be considered rare, because they did study. They only studied about 2,000, which for me is a little low in each of the trials, but it is still so. If anything comes up, it'll be rare. And then I make a decision. Do I want to take this chance of getting him vaccinated based on his health conditions and blah, blah, blah. But I just kind of want to see what's going to happen. I really feel like nothing will happen. I feel like everything that has been studied, this vaccine has been given to billions of people. And if anything was going to come up, it, most likely a lot of the things have already come up. Now, this is a new age group, so you don't know what can happen. So that's why I'm just going to wait a couple weeks, see what happens, and then go. But Lyle wants to get him vaccinated now because he's in daycare now. He just started daycare. No one has a mask on.
Some ammo in there.
No one has a mask on except for Noah. And so he is like, you need to get him vaccinated. And I'm just like, oh, and it was just approved. So we kind of go back and forth with that. I may move my date up. I wanted to wait like 6 to 8 weeks because that's enough time to see if anything new is going to come out. But I really don't want Noah to get sick, from COVID or from anything. So I don't know what I'm gonna do.
I mean, you in the mommy land, right? And it's fine. I mean, you're supposed to do that. I'm gonna be honest though, Doc. I'm actually comfortable by what I'm reading or whatever with the vaccine for the children. At first, I wasn't. But I feel like
got less than 5.
I feel like we tweaked it though. Like the scientists tweaked it. They really were being more persistent with certain areas, and they put the right amount of doses for these age groups. I've been reading, so I'm reading up on this stuff. Like you said, we gotta read the information. Read the information, Doc. I got something for you.
How many kids you got less than 5, George?
None.
That's all I want to know.
I have grandchildren. And they're around me.
Logie.
Yeah. I got grandkids, right? Say like, listen.
Oh my gosh, I know.
Nah, Doc, I mean, take your time, though. Take your time, but don't wait too long. That's all I'm gonna say.
No, that's the fine line that I'm trying to figure out. Like, I want to get him vaccinated as soon as possible, but I feel like I don't know if I'm doing him a disservice by hopping in line early before anything rare has a chance to pop up. And I don't know. It's just,
this is good stuff. This is a real conversation about a parent that's not in line, but thinking about getting in line. I mean, you a doctor, but listen, you a doctor, so that's good. And that's why I think our show is like, it makes it authentic because this is how we really talking. I mean, look, you on a bubble a little bit. We leaning towards it. And if anybody know you a phobic, you don't play that. You walk around with everybody. It could be 1 million people with no mask on. You still got yours on.
Of course. Oh, if it's I might double mask around.
Right. You don't play with that. Then you pull out the steel one. You pull out the. You got the 125 arsenal. So it's just like, nah, Doc don't be playing. But nah, Doc, just take your time. But you already know vulnerable to stuff. So as a parent, you got to keep that in mind. Like if you have a child that's vulnerable to catching colds and especially in a new environment, I would consider it a little more.
I know.
You got some paper for you, Doc.
You're right. The other thing that I consider is like, which vaccine do I get? Moderna? Do I got Pfizer? Right. Me and Bria got Pfizer, Bilal got Moderna. And then everything I've been reading and seeing is saying just get whatever is available. But I don't like that answer. Like, don't just tell me to get whatever is available. Like, I feel like there's a better one. Like, one is better. Coke and Pepsi, which one I'm going to get? I'm probably going to get whichever one's on sale. Right. So it's just like...
Your soda choice is different than these vaccinations in your child. So I get it.
I one works better, does it? I don't know. They didn't do like head-to-head trials to see which is better. So you can't say which is better, but looking at the data, like I feel like if I took some time to look at it, comb through it, I might be able to say one is more effective than the other. But I don't know. It's just a lot. I'm
a Pfizer guy for some reason.
Pfizer.
Only because they've been around. Like even before I was aware, I didn't even know what when the CDC started jumping in my talk and all that. Then Pfizer already was in my head. I heard of Pfizer before.
Yeah, exactly.
With other vaccinations and with other medicines, so it was just like I gave them the nod just because I'm like, okay, I know y'all been in the league.
Mm-hmm. Exactly.
With Johnson & Johnson, I just came in the league, so it was just like
Johnson & Johnson, an old school player too.
True, but I
They've
heard
been
some
around.
stuff about them, so I
They
was
got
just
some
like,
stuff. Yeah,
yeah.
they got an interesting history. They
Right.
got interesting history. Moderna is new. Well, they've been around, but this is their first vaccine that's been approved, that's been out.
Right.
And so that kind of made me a little skeptical about Moderna because they hadn't been in the game for so long. And I felt like Pfizer was making a lot of progress. Like they were doing more. They kind of know the ropes. They've been in the game. They know what to do. They was like moving in a more smarter, strategic kind of way.
Right.
Then Pfizer did something with their data that kind of like
I think they was forged. They did something to try to make it.
I was like, oh gosh. So now I'm just like, I don't like that. Just get whatever is available. I mean, I hear people say that. I know it's probably fine either way, but I just feel like one might be better, and whatever is the one that's better is the one that I want him to get.
Right.
So
they're not the same. I mean, they're not the same. They might do the same thing. They might battle a certain way, but your system depends on, the approach that it takes from the vaccine. So I would just be like you said, just read up on it, and just don't give Pfizer the nod. I mean, you never know. It's just. But I'm just saying, don't wait too long. That's all I'm saying, Doc.
I know. I don't have too much time. But the good thing is that they were both shown to be effective, and so they would not be available if they didn't work. If they didn't, keep kids from having the symptoms. Now, the thing is that another good thing is coming out of the research is that kids that have been vaccinated are not having as high of a rate as that inflammatory condition that kids can get if they get COVID. So that's like incredible. That's like phenomenal to me, because that's the thing that scares me, that if he gets it, he may get the worst of it, and he may have that multi-system inflammatory condition that's kind of going on. And I don't want to go down that path. So vaccinated kids have a much lower risk. It may even be up to 90% lower. I can't remember what the number was, but it was a big deal. So that's still being studied and looked at, but that was a part of what had come out of the research as well. And so it's a lot of benefits to getting the kids vaccinated. I just encourage people to know the information and make a decision. I heard I heard a podcast that Nemours did recently, and one of the immunologists said, only vaccinate the kids you love. I was like, whoa, that was deep. Only vaccinate the ones you love. And the rest of them,
and the rest
of them run around with no vaccine.
Wow.
That was deep.
That was deep.
That was deep. So that made me feel like maybe I shouldn't wait my whole 8-week period. I don't know. I don't know what to do, but he's getting vaccinated. I just don't know how soon. I definitely want him to get it done. I want to move it up sooner because I want him to be protected sooner, but I'm not sure what I'm gonna do right now.
Right.
So what else is going on? Oh, Pfizer, speaking of Pfizer, they have full approval for their 12 to 15-year-old vaccine. So that's a big deal for them, because now they can market it. You may see commercials, and you may see them in magazines and on different ads. And so that's a big deal, that it's a full approval. So people will say, I ain't getting vaccinated because it's not a full, it's not approved. It's not officially approved. Well, it's approved for adults, and is now approved for 12 to 15 as well. So if you were waiting for the approval, parents, it's approved now. 9 million doses of the vaccine have been administered, which is awesome. And it's just safe. It's incredibly safe. Like, if you're going to get vaccinated, this is the vaccine to get, because so many people are getting it all at the same time. If anything was coming up, trust me, it is hitting the presses. It is hitting the presses. So this is like, it's remarkable how safe the vaccine and effective it has been shown to be. It is.
Especially with the kids getting ready to go back to school. And we fully back that. So, I mean, we're even going to have some clinics later on. I mean, some vaccinations days or whatever, like back to school events. So we definitely support that. And then it'll change the school year. At least, in your setting, the more kids that's vaccinated, the less outbreaks we'll have. So, yeah.
Exactly. So we're going to have a couple back to school events. Now, I do want to let y'all know we will be doing some education outreach this weekend. George set this up for Darby's Youth Day. So we'll be out in Darby on Saturday. That's the flyer. So if anyone is listening from that area, from Chester, from wherever, you want to come out, it's going to be a really, really fun day. We'll be out there. And then I also wanted to mention, we hadn't talked about this before, but if you want to get vaccinated, there's some places where you can go and get vaccinated. Dr. Thomas, I popped some links in the in our chat. You can just put those out. If you're in Chester, I listed the website for Chester's COVID info. If you're just in the area and you want to get vaccinated anywhere in Delco, I'll put their website up too. And then if you are tuning in from anywhere across the United States of America, you can go to vaccines.gov. And so that's another website to find out where to go and get vaccinated, because we're not out every weekend, but somebody is. So just find out where to go and get your vaccine. And as always, if you have any questions about the vaccines, you can call or text me at 267-322-0470. So that's all I got for today. Georgie, how about you?
My only parting words is anybody that got that one shot, just get that second one.
That's the whole thing.
I'm gonna just leave that there. Doc, we could probably catch up on that next week, but I'm gonna leave them. That's the parting words I'm leaving with. Listen, if you got the first shot, man, whoever you are, whenever you got it, right? Let's just set up that second one. Just hit me or the doc up, and we'll set y'all up if y'all don't know where to go, if I didn't catch the link. But just get that second shot, please.
Please.
You already past the hump. You got through your hesitation process. You finally let somebody do it. There's just nothing happened. You're still breathing. So come on, let's catch up.
Yeah. Amen.
Yeah. Amen.
Amen. And we out.
Let's open the doors of the church. Good night. Nah, I'm glad you're back though, Doc.
I am.
Les. Thanks to everybody in the back.
Thanks everybody for tuning in. We will see y'all next Wednesday.
Yeah.